lumbar disc herniation is what occurs when there's a weakness in the intervertebral disc and it herniates out, and what typically occurs is it presses on the spinal nerve roots and manifests with the symptoms, which are typically pain, numbness, or weakness going down their legs in a particular distribution based on which discs are herniated. Based on that history, in conjunction with our physical examination to include reflexes, strength and sensory examination, and advanced imaging to include MRIs, we determine if there is a disc herniation, where it is, and the best course of action to follow. First line of treatment, because the majority of these, over 75%, can get better on their own and heal up, is typically oral medications such as anti-inflammatories, sometimes a short course of steroids, in conjunction with physical therapy to really base the exercise and extension-based exercises to avoid compressing the disc any farther, to help with modalities for local symptoms and also help to mobilize the nerve through things that we call nerve glides. Second line of treatment, if physical therapy and other conservative means are failing, is typically more invasive therapies such as injection therapies. The injection therapies provide a steroid, which is a very potent anti-inflammatory, directly to the region in question to try to help with that inflammatory response around the nerve root to help symptomatically while the body heals the herniation. When the conservative options have failed, typically that's when surgery is indicated. In some instances, if people have muscular weakness which is not improving, we get a little more concerned then. But the surgical option is what we call microdiscectomy, where you go in and actually remove that herniated segment off the nerve roots, and you only take the portion that is actually herniated. You maintain the rest of the disc bed intact, and in doing so, in removing the pressure off the nerve root, you can help alleviate the process. So typically the recovery is, of course, over 3 months whenever we do discectomy surgeries, and the reason being is that whenever we decompress a nerve and a nerve's been irritated or has had pressure on it for a period of time, typically it recovers in a fashion with which pain typically gets better the quickest, followed by any weakness, and finally by numbness. Unfortunately, numbness is the least predictable of all these things, and sometimes, depending on how much pressure or how long the pressure was applied, the numbness may stay, but thankfully, more often than not, the strength comes back and the pain goes away. If any folks are suffering from these types of problems, we have several operative and non-operative specialists that can help them with these ailments. They can make an appointment with Vail Orthopedics at any of our offices in Edwards, Frisco, or in Vail.